Hey, thanks for checking out this video. You're about to learn a simple kinesio taping or K-taping method you can do on yourself that is often quite helpful for generalized knee pain and discomfort. Now, I want to be respectful of your time, so we're getting right into it, but if you want to learn the details of this taping technique, particularly how it can help turn down nociception and improve proprioception for your knee, along with what the scientific research has found for kinesio taping, then be sure to check out my Science of Kinesio Taping video after I've walked you through this taping technique, where I'll tell you all about it. As we kick things off, please keep in mind that this taping technique in this video is a generalized application that works well for mild knee discomfort, but as with nearly all kinesio taping techniques, there is more than one way to tape this area of the body. As long as we follow a few basic principles, you can often get creative with the rest. Kinesio taping really is half science and half art. I'm keeping it simple in this video to help ensure that you can do this on yourself without any issues. So for this technique, you'll need 2 strips of tape about 14 inches long and 1 shorter strip of tape around 4 inches long. Start by making sure your skin is clean and dry. Also, be sure to buzz down any hair over the area that you'll be taping, as this will ensure the tape sticks to your skin. Next, round off the corner of your tape strips using a pair of scissors. This is done to help ensure that the tape sticks to your skin because sharp corners like to peel up rather easily. With the tape all ready to go, bend your knee to approximately 90 degrees. If you can't achieve this position, just get as much of a bend as you comfortably can. We want to apply the tape with the knee bent since the skin is stretched out in this position, and this in turn will help with decreasing nociception to the brain as the tape will pull and lift your skin a bit more when you move it. More on that after we finish this taping application. Next, peel about 1 inch or 2 of the paper backing from one end of the tape and place this portion of the tape a couple of inches below the bottom of your kneecap. Place it just to the side of the front ridge of your shin bone and angle it upwards, and make sure it's firmly anchored to your skin. Now, pull the tape upwards and cross it over your shin so that it's just off to the side of your kneecap. As you pull, stretch the tape to about 25% of its full stretching ability. Keep pulling the tape upward and cross it over the top of your thigh so that its path resembles the curve of a banana. As you lay the last inch or 2 of the tape down, do so without any stretch on the tape, as this will help avoid skin irritation. Next, we're going to repeat this process on the other side of the knee, essentially creating a mirror image. So repeat the exact same process, but while going to the other side of the knee. Once you've got both of those strips laid down, it's time for one last piece, which we're going to lay right over the patellar tendon, which is the thick cord-like structure you feel just beneath your kneecap. And hey, super quick, if you're finding this video to be useful or helpful or informative, or if you simply appreciate the hard work that goes into making this content as a solo content creating physical therapist, then hitting the like button would mean a ton to me. And feel free to subscribe if you'd like to stay up to speed on all the content I'm posting here on the channel. Now, back to the taping. So for this last piece of tape, start by tearing the paper backing of the tape down the mid portion of the strip. Peel the paper backing away, and with about 50% of a stretch applied to the tape, lay it directly over the tendon. Take the remaining inch or so of tape on either side and lay them on your skin without any stretch. If desired, you could repeat this process with an additional strip of tape just above your kneecap, and that would lay it over the common quadriceps tendon, which could come in handy if you tend to have some knee discomfort in this area. When I'm taping my patients, I will sometimes include this strip and other times I won't. I always try to individualize certain aspects of my taping based on my patient's needs and preferences. So now that you're all taped up, straighten your knee and you will see that your skin becomes super crinkled and wrinkly when it's straightened out. And this is exactly what we want. And if you want to know why, be sure to watch my Science of Kinesio Taping video. So there you have it, a simple and straightforward kinesio or K-taping technique for the knee. And if you feel like this tape helps, you can certainly leave it on for a few days, and you can even shower with it on. Just be sure to pat it dry rather than rub it when you're drying off. All right, everyone, so what the heck did we just do, and why did we do that taping technique that particular way? Well, watch my Science of Kinesio Taping video if you want the rundown on all the cool stuff pertaining to how this taping method works, why it does what it does, and some other neat things along the way. And in the meantime, keep looking after yourselves, keep looking after one another, keep making great things happen, and I will see you in the next video.